Hi everyone, I want to talk about pain treatment. This will take us through a series of lessons because we cannot just have pain treatment covered under one or two lessons. Okay, let's go. First thing is definition of pain. Pain is an unpleasant physical sensation and could also involve emotional experience that may be localized or diffused. Pain could signal an ongoing injury or a disturbance of the regular metabolic activities within the body. It can be an acute or chronic type, might be cancer related or non-cancer related, might be neuropathic or vascular, could be localized or referred, and sometimes could be diffused. The treatment will take into account all the above and many more factors. When it comes to chronic pain, we can manage chronic pain with the following modalities, either non-pharmacologically, pharmacologically, with the aid of physical medicine, behavioral medicine, neuromodulation, for example, electrical stimulation of the central nervous system, interventional, surgical approaches like neurotomy, rhizotomy, sympathectomy, cordotomy in case of Pancoast tumor, and root avulsion treated with dorsal root entry zone, and so on. But the beginning should involve the following, and that is you're going to start with evaluation. First thing first, we're going to take history. What is this all about in the life of the affected individual? We're going to have physical examination done, and you might or not need an investigation or investigations. And once you have taken your history, I'll go over some of the components of your history in a bit. But once you've taken your history, you've done a physical examination and carry out possible investigations. And the next thing is to educate the affected individual as per your findings. And let him or her know whether this is an acute situation or chronic, whether it's cancer related or non-cancer related, and what your findings are, specific diagnosis. And then you might be able to reassure and set reasonable expectations. You can involve aerobic exercise, acupuncture, massage, and then you start thinking about pharmacological approach like the use of non-opioid, opioid with or without adjuvant therapy. What are the possible signs of pain? Okay, the individual could be crying, particularly children, and don't let me stop at that. It's not only children that could cry when they're in pain. A lot of people do. Agitation, like someone who could not express him or herself in the hospital admitted, could be hitting nurses for no reason. That may be as a result of pain, particularly patients with dementia. There could be possible mourning, and some will be activating alarm system more frequently. That could be a sign that he or she is in pain. Resistance to passive movements and body stiffness. Some people could even have guarding and limping or untangled gaits. Remember when we were kids, sometimes we may not tell our parents, but by the time we're limping, they'll know we've had one trouble or the other with our extremities. Frequent touching or rubbing pain sites, particularly in children and nonverbal adults. Uncooperative patients, yes, don't blame them. If they're in pain and they could not express themselves, They're not going to take anything from you. Eyelids tightly closed or grimacing, and you could become very restless. Pain severity is very important here. When you ask the patient to tell you how severe the pain is on scale of 0 to 10, with 10 being the worst, if the patient says 9 to 10 over 10, that means the pain is unbearable. Sometimes they may tell you it's between 7 and 8, that's very bad. But if they say 4, 5, or 6, that's moderate. And anything between 1 to 3 is mild. If they say 0, then that means no pain at all. However, this might be subjective because some individuals, for purpose known to them and one known to us, which could be someone seeking narcotics, particularly those that are opioid tolerant or those that are already addicted and abusing the medication, can give you 8 to 10 over 10, or some will even tell you 12 over 10 or 15 over 10. Why? They are just attracting your empathy and making sure you give them something, and particularly opioid. So you have your high sense of suspicion when it comes to how somebody is rating the pain, like someone rating the pain 10 over 10 or 12 over 10, and you turn your back to go and pick your meds or call a doctor or call other members of team to see what's going on, and before you come back, he or she is already sleeping or snoring. 10 over 10 or 12 over 10 or 15 over 10 or 20 over 10, sleeping and snoring within 30 minutes or 1 hour of interaction, that's a lie. Okay? So, high index of suspicion as per the severity. Then, while taking the history, we have mnemonics like OA, PQ, RST, UV, W, X of pain characteristics. When is the onset? Any elevating, any palliative or aggravating factors, quality and radiation, the size, the severity, the timing, your understanding, any vomiting, as you tell with any other thing, and so on and so forth. So when we come to history and physical examination aspect of my channel, we'll go into details of all this. If unconscious, if somebody is unconscious and is in pain, you're going to see limb movements, and the individual might keep to a particular posture because moving the opposite direction might trigger the pain, and they tend to keep that particular posture. That may be a sign in an unconscious patient that is in pain. And also unconscious, check the facial expression. Is he or she grimacing or eyes are tightly closed? Then you could be getting to the conclusion that he or she is in pain. What about compliance with mechanical ventilation? Someone in pain might be fighting the ventilator. That might be the sign that you're going to pick. Yes, when we're talking about pain, like we've done in the last few minutes, it would be bad to just move to another topic without talking about genes or genetic constitution. Therefore, it is noteworthy to state here categorically that perception of pain could differ based on inherent or innate characteristics embedded in our genetic constitution. In other words, perception of pain is variable, and that determines the approach to alleviating the same. Some have high thresholds, That is, they don't feel pain easily. Some have low threshold. That is, they feel pain with just a little stimulus. Genetic polymorphism have been implicated in the serotonergic system, just as it is in dopaminergic and catecholaminergic systems. Allodynia, which is painful response to non-painful stimulus, and aparageusia, which is exaggerated reaction to painful stimulus, are examples. Cultural aspect of pain. Somebody is asking, how do you mean? Cultural aspect of pain? Yes. Some believe that men should not cry, and if they do, they are weak men. Do you believe that? That's it. Find out. Some have been taught that crying or shouting would never alleviate the pain. Well, we're true. And there was a case when I was having my internship in OBGYN, and I was counseling a primate, a woman that was pregnant for the first time, that when you reach the labor period and the pain will be coming, waxing and waning, that just crying and shouting will not really solve the problem, that we will know, I will know, that you'll be in pain once I feel the contraction of your, uterus. And you yelling, throwing stuff will not really relieve the pain. And you know what? The young woman came in to the hospital in labor. I was not at the labor ward that day. I was now working in another unit entirely, but she was admitted into the labor ward, and before the nurses who noticed, they just felt that she was grimacing, but not shouting, not yelling, not crying, and a nurse just checked the perineum. Lo and behold, the head of the fetus was at the perineum. And one of the nurses said, "Why is it that you didn't even yell and you're a primate?" And she called my name, that I advised her yelling would not solve the problem. So it's a true life story. Chronicity could also lead to changes in response, because since the individual has been bearing the pain for an appreciable period of time, particularly a long period of time, he or she would have adapted one way or the other. Impact of pain, emotions. Now, some people, because of prolonged or chronic pain, they will develop some emotional problems. They could become depressed. They become anxious. There's possibility of decreased productivity, because it depends on the type of the pain. So some people will not be able to work in their area of training anymore, and some will be limited or restricted to certain activities that will alleviate the pain, or at least that will not trigger the pain anymore. Then there's possibility of decreased self-esteem, particularly severe chronic pain for a long period of time. They can't do just everything they've been doing in the past. No going camping, hiking. You understand what I'm talking about? Biking, traveling far distances, across Europe to North America to Europe, biking, socializing, or dropping because of chronic pain. There's possibility of increased aggression, particularly in non-verbal people, because they can't express themselves and they're angry because they're in pain. There's possibility of loss of income or increased poverty. And needless to say, once we've just mentioned that an individual will have decreased productivity, then what next? The income will drop, of course, and with that, poverty level might increase. And another issue is side effects of the analgesics that we're going to load them with. How about dependence on others for survival? Because they can't just function well anymore, and job loss. You are the manager and somebody is complaining about back pain all the time, and you need to lift this stuff and that one from one point to the other. That's your job, that's what you do. So what's going to happen? The manager will just hire someone who is not having pain and who could do the job, because at the end of the day, the manager is concerned about productivity, get the job done. Marital disharmony. I'm not going into details of that. Adults will understand what that is all about. Drug addiction. Of course, particularly opioids. With time, you become tolerant, dependent, and become addicted. Suicide. Yeah, a lot of people in pain, chronic pain, is a key factor in suicide. Okay? From depression to suicide. Yes. The focus of my series of lectures on pain will be on non-cancer related pain. It could either be acute or chronic or combined. And with that, I'm ending lesson 1 right now. And I will move to lesson 2, which will be about neuropathic pain. Thank you for listening. Kindly subscribe to my channel so that you can get all the lessons on pain and other related subjects or medically related subjects on my channel. Thank you.